let's go to cholesterol, because such an important thing. We hear so much about it, and we hear all the numbers and the different kinds. It's very confusing to people. So how do you guide your patients on cholesterol?
Okay, so when you come into the office and we're talking about that and measuring cholesterol, we're going to do a lipid panel. That includes...
Lipid panel means what?
Lipid panel. Lipids are blood fats, you might say. And it includes cholesterol, total cholesterol. The number there you're looking for is lower the better, but 200 is considered the upper limit of normal, most labs. You're looking at triglycerides, another blood fat with a different composition. Lower the better. 150 is considered upper limit of normal in most labs. And then you're looking at what's called the HDL, which is the high density lipoprotein.
That's a type of cholesterol or triglyceride?
It's a type of cholesterol is part of the lipoprotein system, and HDL is the good fraction, LDL is the bad fraction.
So we want more of the good?
You want more of the good, less of the bad. And those numbers vary in terms of goal based on other factors, for example. But the lower your LDL, the better. The higher your HDL, the better.
What's the best way to get the LDL low and the HDL high? Are there medicines that do that, or exercise, or diet, or what? How do you guide your patients?
All of that is the best way. There are lifestyle things that you can do, which includes regular physical activity. Exercise is very good for your blood lipids. Keeping your weight where it's appropriate, just keeping your weight where you want it, that's very appropriate. And then, of course, a diet that is relatively low in fats, especially saturated fats, will help lower your cholesterol. Moderating sugars and starches in the diet, such as bread and pasta and potatoes, that will help lower triglycerides. So you may have to look at both of those things depending on what your panel shows.
If somebody uses diet, exercise, the right kind of foods, and their cholesterol still is abnormal, are there good medicines, and what are those, and how do you take them?
Absolutely. There's a variety of medicines that are used. By far, the workhorse drugs are the statin drugs, which most everybody's going to have heard of. Lipitor and Zocor. Generically, that's atorvastatin and simvastatin, and there's a variety of others. Those are the ones with the best data showing reduced risk of heart attack and stroke when we use them.
So are they good medicines? They have any, the worst side effect of those medicines would be what?
The worst side effect would be what's called rhabdomyolysis, which is a breakdown of muscle cells that causes kidney failure. Very, very unlikely, very rare.
That was a big word, rhabdomyolysis, but that protein clogs up the kidneys in late term, and is that what it does?
It is what it does. However, it does it very rarely. I've never seen it in practice in my patients. Much more commonly, though, you see muscle achiness, what we call myalgias or myopathy. And that's just a nuisance kind of thing that sometimes people can just live with. Sometimes we improve that by moderating the dose of the medicine. And then sometimes people feel like they can't continue to take the medicine because of that.